Hello everyone, I'm Shivani, a health coach at Besugarfit. Today we'll discuss about how we can reverse chronic conditions through our behavioral modifications. Fluctuating blood sugar conditions have been observed to cause anxiety, depression, and mood swings. Controlling these emotions are key to normalizing health, and the first step to do that would be by monitoring blood glucose levels. A reliable way to get biofeedback and derived insights into how glucose levels and moods are related is through continuous glucose monitoring, that is, the CGM. How many of us exercise daily, eat healthy, and are disease-free here? Put it another way, how many of us are aware about our health conditions, given the modern lifestyle challenges? This will again make us think about our priorities and explain poor lifestyle habits or behaviors. Deep down, we all know that we need to get out of our comfort zone and start thinking about our health, but we are reluctant to change. So, what are the barriers that prevent us from choosing healthy behaviors? Management of diabetes and other chronic illness require healthy habit formation. Various barriers prohibit us from adapting to new behaviors. How many times do we say in a day, from tomorrow, I don't have time, I feel tired, I want to, but my body does not allow? I can't do that. So if we do a little introspection, we can correlate and attribute these excuses to one or more of the following barriers. Lack of motivation, poor eating habits like eating really quickly, skipping your meal, taste preferences, dependence on addictive processed food, unavailability of healthy foods, and the modern culture which promotes a sedentary lifestyle and a busy work schedule. So, what is the impact of my diet and lifestyle habits on chronic disease like diabetes and heart disease? Chronic conditions share the cause and bear the burden of behavior or lifestyle-based risk factors like poor dietary habits, sedentary lifestyle, physical inactivity, tobacco, and alcohol use. Let's explore how each of the below behaviors can help us. Eating healthy. It is the crucial thing in controlling diabetes and cardiac diseases. Managing blood sugar level is very important, and this can be achieved by increasing the number of whole grains, fruits, and vegetables. On the other hand, limiting the processed foods or foods which are rich in sugar and fat. The goal should be to increase the amount of fiber, antioxidants, and other supplements. These dietary measures become far more important in persons who are already taking the anti-diabetic medications or insulin. Then comes maintaining a healthy weight and BMI. Decreases insulin resistance, helps in managing obesity, and reduces diabetes or associated complications in diabetics. Monitoring blood glucose always, it's like the key to manage diabetes and associated complications. Diabetes affects other vital body organs like your heart, kidney, liver, nerves, eyes, and so on and so forth. So regular checkups should be planned. Regular cardiac monitoring to prevent the risk of cardiac complication and helps the healthcare to manage the condition really well. Then comes our exercise or physical activity. It is very crucial in controlling these chronic conditions. Exercise increases the use of glucose by muscles and reduces insulin resistance. It helps to increase metabolic activity and helps your body to eliminate toxins and uplift the mood. Smoking. It is a strong risk factor for cardiac disorders. If you have diabetes, the risk is even more. Smoking also makes exercise harder due to reduced lung capacity. Alcohol consumption, it causes fluctuations in blood glucose levels. American Diabetes Association says that women should have not more than 1 drink per day and men should not have more than 2 drinks. Stress, it causes blood glucose levels to go up and can worsen diabetes. Behavioral changes in diet and lifestyle to reverse chronic conditions. So the majority of chronic illness are associated with increased insulin resistance. Adapting to healthy habits, exercise, and weight management reduces insulin resistance and consequently will reverse the chronic conditions. However, motivation and dedication are required to follow a regime for a stipulated time to witness the change. Research has shown that the utilization of behavioral science at individual or community level has enhanced behavior change. So, what are the 4 factors that facilitate effective behavior change? Behavior change can be induced through 4 factors: control theory, open and closed loop systems, body awareness and interoception, accountability, personal control. Let us now see what each of the factors mean and how they impact and bring a positive change in your behavior. Control theory and loop systems. Control theory deals with the controlling the outcomes with various variables through a controller. The controller can achieve the required behavior through active monitoring. Control theory has 2 subtypes, the open and the closed loop. In closed loop system, the action of controller is dependent on the process, variable from the process feedback. In other terms, actions are directly related to the results. Interoception. Interoception is the sense of somatic awareness wherein the person is aware of his body, functions, and signals. This can be as simple as a pain sensation. Interoception is usually associated with motivation and increased mental and physical health outcomes. Metabolic awareness is the new term in the context of glucose and metabolism-related awareness. Accountability. Accountability is a sense of obligation towards reaching an objective or adapting to a new regime. In the context of behavior change, accountability works at a deeper level, where a person feels obligated to the social pressure or peer pressure to adapt to the new behavior or the habit. This acts as an internal motivation to step up and adhere to the new behavior. Objective control. Objective control is a practice in which the control is exercised to reduce the options and improve the results. In behavior change, objective control will have a clear choice that will help the person to adapt to those changes and bring out positive outcomes. This will elevate overall well-being, elevate the mood, and easily adapt to the behavior changes. Bottom line, to conclude, behavior changes help to reverse chronic conditions. Of course, some barriers prohibit us from adopting healthy habits, but we can practice healthy habit formation with behavioral science. We should eat healthy, exercise daily, manage stress, reduce alcohol use, quit smoking, and maintain a healthy weight. These behavior changes can be inculcated through personal control, a sense of awareness, accountability, and control theory. Healthy habit formation is the key to effectively monitoring chronic illness. If not by leaps, baby steps should be taken, small steps, to induce behavioral changes and consequently improve the quality of life. Thank you.